Hi guys, I'm going to walk you through how we are changing our practice so that we are the ones priming the MRI tubings when we go to MRI. So if you come over here, you'll see we have our supplies. We have the MRI tubing, one for each drip, alcohol pads. You need one 10cc syringe per each drip, and then these universal blue caps are really handy to have. So I'm going to wash my hands. Start always by washing your hands. And then applying gloves. As you can see here, we have Levo running at 0.02 or 2.3 mLs an hour. So what we're gonna do after we get our gloves on, we're gonna take an alcohol pad, we're gonna take our 10cc syringe, and then I'm just gonna go ahead and open up the MRI tubing to make it easier once I have the syringe filled, and leave it open like that. I'm gonna come over here. So as you can see, this is running at 2.3. What I'm gonna do is I'm gonna scrub this hub just like you would any other access point. Scrub, scrub, scrub really well. And then take your 10cc syringe, twist it on. This is really important. You kink it off here. I like to hit pause just so it doesn't yell at me. And you need to pull up the entire 10 cc's of volume and go ahead and hit restart. I like to knock out all of the air. There's no air in there. It does take exactly 10 cc's. I like to get as much as the syringe will handle. So then I go back over here to my MRI tubing. Do not pop these these white labels. That is the bane of my existence. It will make your life much more difficult. So then you just push this through. It is very, very important if you have multiple drips to label everything at every point. So you have to label it here, you have to label it here, and you have to label it on the tubing. And if your patient has multiple drips, I like to label it at the lumen that it's coming out of, because unfortunately once clear liquids are in a tube, they all look the same. So as you can see here, this is fully primed. There's no air in my line. So I'm gonna leave this as is. Right, you can do this on the floor, you can do this in MRI, wherever you're comfortable with. This is still sterile, so sometimes what I'll do is just hang this up here. I like to hang it so that this is dependent, but that's just me. And at no point was our Levo ever stopped. So we're in MRI now. We have our patient, we still have the Levo running, and we're ready to start to transition into the room. So we're gonna come over here, same thing, wash your hands. And same as before, I have some supplies here, always alcohol swabs. I have a stopcock, you'll see why in a minute. And then I have those same blue caps from before. Those are very helpful at the end of this process. So when you come back over here, we're gonna leave this running. The entire time you have multiple crew members, you know, somebody's getting them on the monitor, people will help them move them onto the MRI table. You're gonna take this tubing that we primed before, and now is the time we're gonna walk over here. This is when we're gonna pop these seals. There's always one twist in here. So you wanna look at it before you start untwisting anything and seeing which way everything's going. There's usually one twist in it. Once you find the twist, it's easy as pie. If you don't find the twist, you make your life very difficult. So you unwind, unwind, unwind. This entire time, Levo is still infusing into our patient. So you have it unwound. Now you got two ends. You have this end, which is slightly blue tinted. You have this end, which is connected to the syringe, which will eventually be connected to the IV pump. You want to send the blue one through the tube. Blue through the tube. That is the one that will connect to the patient. Some people call it the male end. So what I like to do is take, especially we're in room 29, one of the newer rooms. So I take the syringe in and I loop it right here before I go in the room. Now obviously, because this is a camera, she can't come in with me, but I'm gonna go in, I'm gonna pull out the other end and I'm gonna bring it up. Right there. So this is the end that's gonna connect to our patient. So I like to pull all that slack through. And then if our patient had multiple lines, we would label every connection point. because this is only running at 2.3 mLs an hour, it would be really handy if we had a device, if we had a carrier and then we had a device to split it. You cannot Y things outside of the MRI room. You have to Y them inside. That being said, you prime normal saline just as you normally would. You prime MRI tubing with normal saline. You do the same process. You label everything really, really well, you know, to differentiate, this is levo, this would be your normal saline. And then you put your normal saline through one end and you put your levo through the other, so that that way everything is extended. You cannot extend anything outside of the MRI room. But then all we have to do to transition somebody, you do have to think about which way your IV pole is going to fall. So this is going to stay on the outside of the room, obviously. This is going to go on the inside of the room. It's not twisted, it's not tangled. So what I'm going to do, grab my alcohol swab. I'm going to open one up. From here, I'm going to undo it. Swab, swab, swab. Holding. I'm going to connect it here. And then I'm going to take this end and connect it to where my syringe is. And never once did the levo stop running.